Hi, I'm Larry Dignan with Constellation Insight, and we're here with Johnny Wu. He is Chief Clinical Officer at Centurion Health. Hi, Johnny. Thanks for joining us.
Thank you, Larry.
And congrats on the BT150.
Oh, thank you. I mean, it's a wonderful honor to be able to be named, especially in my field, since we don't get much recognition.
So I guess I'll just start off the top. What does Centurion Health do?
So we are one of the largest healthcare companies in the correctional space. We currently provide health services inside the prison 24/7 across 300 prisons across the country.
And you're Chief Clinical Officer, so how do you interface with tech and the tech leadership team?
Sure. So, I mean, we provide care inside the prisons, and it's very challenging because of the limitations of the prisons being concrete, rebar, lack of being able to bring cell phones in. But we are trying to incorporate a lot of technology. We're actually trying to provide care by going directly to the patients. I mean, it sounds a little bit weird that the fact that they're a captive audience, but sometimes we don't even have access to them. And so for us, we have medical clinics, but we're trying to move towards, particularly in the time of COVID, trying to go out to the housing units where the inmates are located and providing care. So we're using like tablets, technology, doing telehealth inside the prisons from our clinic area to directly where the patients live. So my interface is, I'm the Chief Clinical Officer, so I provide direct patient care and oversee that. But the IT department is constantly developing data to help me to be able to provide better care in real time.
So is there electronic health records and a platform like that, or is it mostly edge computing because just of the environment that you have to go into?
So unfortunately, there's a lot of jurisdictions that we have to deal with. So each state has their own prison health system. There's also the federal system and then the county jails. And each of them don't communicate. They have different budgets. And so you could be working in a system where they have very robust resources and they have electronic health records. Some are actually still working on paper. I have one state that currently, will not name them, but they're still working on paper and they're transitioning hopefully next year to an electronic health record.
Wow. So you just have it's like a diverse environment you have to work across by state, by prison, so how do you sort of standardize?
So it is a challenge. Each of our contracts have different requirements, and so we have to kind of make sure that our staff are aware of what the regulations and what we're responsible for in each of these areas. Then we have a corporate team called CSG, Central Services Group, and where we try to bring it and try to make it all level across the enterprise. But a lot of times it's really our local folks that kind of come up with the ideas on how to make things work. But we just provide kind of like consultation from the corporate level.
Is there, if you had a magic wand, technology-wise or care-wise, what would you fix and how?
I think, the first thing is we need to just move away from the mindset that we have to do things the way we've always been doing it and then adding technology to keep doing it the way we've always been doing it. We just need to start fresh. I mean, there's so much that I would like to do. First off, I would like to be able to have mobile technology, be able to have Wi-Fi and cellular service inside the prisons. Because at this point, I have folks who I can't even communicate because there's no way for them to have a cell phone inside the prison while they're working.
So how does something like telehealth work in that situation?
So traditionally, when we talk about telehealth in the prison system, it's like a standalone machine. It's like outdated where you have a screen where you have the patient sitting in front with a chaperone, and then at the other end, the provider could be remotely in another location inside the prison or just even at home. And we're using just software that goes through the internet, but it's very limited. It's really how do I say, very impersonal. But there are trends we're moving towards to be able to have using peripherals. In some of our programs, we've actually gotten permission to actually use peripherals to collect data. So we can actually collect heart rates, collect the sounds of their heart, their lungs, and in real time, the provider at the other end can hear this and then make adjustments to the treatment plan based on real-time data that they're having in front of them.
So is that like using wearables? Like, do you have to bring the wearables in, or are they already there?
So when we talk about wearables, that's something that we've been wanting to utilize. Unfortunately, security trumps everything.
Right.
So a lot of times the wearables are made to be too small because it's made for the general consumer. For our world, it could be swallowed or taken away, hidden. So it poses a challenge for us to be able to have permission to use wearables like that, the consumer products. So a lot of times we kind of have to, jerry rig and make our own type of wearables, which is not always ideal, but we do what we can. I mean, there are some technologies where we're looking at using sonar to be able to collect some information. But again, we're working in the house of custody. We don't own the physical plant or office space, and so we can't make changes that readily easily.
So how do you think about process, or do you have to, I mean, I just think with the environment that you operate in, process almost has to be, it's almost bespoke, right?
So, it's a partnership. So you have to work with the client. The client understands that there's an obligation to provide health care, and you kind of have to work together to make sure that each side is supporting each other. I mean, when I started my career in correctional medicine over 20 years, I was working in a broom closet or sometimes working in a jail cell. But nowadays, they're starting to think of, okay, if I'm going to build a new prison, I'm going to have, my medical people involved with the design of it. So I've been lately more involved in that aspect. They're now understanding the need for medical care as they, the older construction prisons are being phased out and they build new ones.
What's the most rewarding part of your job?
Well, I mean, I love patient care. I think I make a difference every day. I mean, a lot of times it's as simple as going into a facility and talking to people, and people remember me and they're like, oh yeah, you took care of me, blah, 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 you did this. And, it's just, for me, very rewarding to know that people appreciate what we do in there.
All right, great. Thanks for joining us.
Thank you.